This presentation is on how to choose a Medicare plan. We're going to share with you the basics of Medicare and all of your options. When choosing your Medicare plan, it's important to note that there's only 5 options. Original Medicare all by itself is an option, although not too many people pick that. The next option is group health insurance. Group health insurance comes in 2 types, employee group and retiree group. If you're covered under employee group health insurance, in almost every circumstance, you can stay with that employee group health insurance, not select your A of Medicare, and not suffer any penalties when you later separate from that employer plan. However, if you're covered under retiree group insurance, in almost every circumstance, you're going to need your A and B of Medicare to go along with it. The next option is a Medicare Supplement. Here's where folks get into trouble sometimes listening to friends and family. A Medicare Supplement actually is a federally standardized Medigap policy. We'll get into details on those plans in a couple of slides. The next option is Medicare Advantage. These are the network-based programs that work pretty similar to the group and individual insurance you've had all your life, but in many cases, no deductible with Medicare. And the final option is Medicaid and Medicare together. That's where the state and federal government partner together to take care of copays and premiums for low-income Medicare beneficiaries. That's it. That's all 5 options. Now, there's lots of choices, but there's only 5 options. If you're getting close to turning 65 and noticed an abundance of mail from insurance companies popping into your mailbox, well, here's why. There may be between 40 and 70 insurance companies trying to sell you a Medicare supplement. It's important to note, when you're shopping for Medicare supplements, they're exactly the same. It doesn't matter which insurance company you buy it from, the benefits are 100% exactly the same because they were standardized by the federal government in 1989. When considering Medicare Advantage plans, they are zip code specific, so a plan that's available in New York State may not be available in Alaska, and certainly would be different than a plan available in Florida or Arizona. So it's very important to do your shopping with Medicare Advantage plans and take note that one plan is not necessarily available in another area. Medicare Advantage plans are offered by many companies. They'll have multiple different plans in the same area, but they'll use different networks. All of the benefits are standardized, so it doesn't matter which plan you get, the benefits will be the same, but your copays and networks will differ. Let's brush up on some Medicare definitions. A copay is the amount of money that you will pay in exchange for a service. A deductible is the amount of money that you must pay before the plan pays. The network is the list of providers associated with a specific plan, and the out-of-pocket maximum is the maximum amount of money you'll be responsible to pay for medical expenses, excluding prescription drugs, in a calendar year. When choosing a Medicare plan, the 2 most popular options are Medicare Supplement and Medicare Advantage. If we take a look at the blue column, a Medicare Supplement in 2020 typically means Medicare would be your insurance and a federally standardized Medigap Plan G would pay the balance of the bill as instructed by Medicare. With this option, you can use any doctor, any hospital, anywhere in the United States. You won't experience a copay for any medical services. The annual deductible is $198. That means that your out-of-pocket liability for the year would also be limited to $198 in year 2020. On this column, you would be adding a 3rd card to your package. That would be a Part D prescription drug plan. The most popular reason people select from this side of the fence would be freedom of choice, to use any doctor, any hospital, anywhere in the United States, you wouldn't experience any copays, and you don't need a referral to go from doctor to doctor. When considering Medicare Advantage plans, remember that these are network-based programs. In many metropolitan areas, many doctors are in multiple networks, making it pretty easy for you to find your docs. You'll have copays and coinsurance for every service. Most of the plans have no deductibles for medical services. The out-of-pocket maximum is currently capped for 2020 at $6,700. That's not a deductible, but the cap to the amount of money that you can pay in copays in a calendar year. Most of the plans have the Part D prescription drug benefit built in. The most popular reasons people select these plans is most of the plans have no monthly premium over and above Medicare's charges. You'd pick the plan because you got to keep your doctor, the drug benefits built in, and simplicity of use, because with Medicare Advantage plans, you don't have Medicare anymore. You've transferred your benefits to that Medicare Advantage plan, and you use one card for your doctors, hospitals, and prescriptions. When looking at premiums that you can expect to pay, they will vary widely. But let's start with the original Medicare. Part A of Medicare will be at no cost to you as long as you've worked 10 years in the United States and paid your taxes, or married to somebody for at least 10 years and they've worked 10 years in the United States and paid their taxes. Part B of Medicare has a base premium illustrated on our slide, and it changes every year. Sometimes it goes up and sometimes it goes down. However, the Part B premium is based on income, so there could be surcharges based on what your income was 2 years prior to your Medicare eligibility. The Medigap Plan G, on average nationwide, is right around $120 a month, but the premiums do vary widely throughout the United States. Medicare Advantage premiums, on average, are $0, but they do vary widely throughout the United States, so you want to check your local rates. The Medicare Part D premiums that would be attached to the Medicare Supplement, on average nationwide, are right around $30 a month. The Part D is usually included on the right side of the fence when it comes to Medicare Advantage at no additional charge. So you could see the numbers for the totals with Medicare plus a Medigap plus a drug plan listed on the left. The only copays you'd be responsible for would be for prescription drugs. And on the right, you'll see the totals there as well, and you will have copays for doctors, hospitals, and prescription drugs. A Medicare Supplement or Medigap plan is offered by insurance companies under very strict guidelines. A Medicare Supplement Plan F from one company is exactly the same as a Plan F offered by another company or any of the Medigap carriers in your state. Understand, with Medicare as your insurance and a Medigap plan, Medicare processes each and every one of your claims. Medicare electronically notifies the Medigap company as to who to pay and how much to pay. So the Medigap company doesn't really do very much. Medicare is actually your claims processor and your insurance. Switching gears again to Medicare Advantage plans, these plans have federally standardized benefits, but your copays will differ by plan. Selecting a Medicare Advantage plan may have more to do with the choice of doctors and hospitals offered by a particular plan than the premium, brand name, or even the plan rating. If you'd like to do more in-depth research, may we suggest a book called Medicare Made 123 Easy. It was published by the founders of the Medicare Architects. That book's available on Amazon.com, BarnesandNoble.com, and Walmart.com. There are two great websites to check out when you're doing your research for Medicare. Medicare.gov is the only place you can go to check the cost of prescription drugs on every plan available in your zip code. The MedicareArchitects.com is a great set of resources as well. It's designed specifically for folks that are exiting employer plans and the HR managers that help them. If you'd like to stay up to date, may I suggest a subscription to the American Retirement Advisor newsletter. It comes out every month and it's available digitally. If you're one of those nice folks that are thinking about a Medicare supplement, wouldn't it be helpful to have the rates from every company available in your zip code? If you're thinking about Medicare Advantage plans, wouldn't it be nice to have a side-by-side comparison of every plan available to you? Well, if any of this information sounds like it would be of benefit, give us a call or hop on our website and we'll be happy to prepare that information and get that out to you right away. Thank you so much for watching How to Choose a Medicare Plan. Have a great day.